Welcome everyone to our May 2025 SimCity rounds. It is with great pleasure that I'm going to introduce our speaker today, Dr. Tim Willett. He is the president and CEO of Simulation Canada, which is a national organization dedicated to advancing healthcare through simulation-based education and innovation. He has held this leadership role since 2016, following his tenure as the organization's inaugural director of research and development. Dr. Willett's career has centered on the intersection of healthcare education, technology, and leadership since 2005. He's recognized for his passion and advocacy for the transformational impact of simulation in healthcare, particularly its potential to address workforce challenges, enhance training quality, improve patient safety, and prepare professionals for future health threats. So, Tim, I got that off my AI.
Oh
So
dear.
I hope it did you justice.
That's what ChatGPT knows about me?
Perplexity, yes. So thank you.
Perplexity.
Thank you so much for being here today and for being so willing to move us forward by talking about virtual simulation. I'm going to hand it over to you now, and I'll manage a chat for you when we
My
move to question
my
and answer.
pleasure. Thanks for having me here. I'll have the chat window open too, so I can keep an eye on that. And I also don't mind people unmuting and just jumping in to interrupt me. Really, it's I'm quite happy with that. So welcome to talk about virtual simulations. I am joining you from Treaty 27 and a quarter territory. That is the pink area you see in the middle of the map here. I live just northwest of Ottawa. Um, this is traditional territory of the Algonquin Anishinaabe people and was uh, sold in the 1800s to the Crown in order for the Rideau Canal to be built um, for what equates to in modern dollars to be a little over about $500 a person um, to a maximum of 267 people. So really a paltry amount of money for 2.7 million acres. For disclosures, I am a paid employee of Simulation Canada. I'm going to be talking about virtual simulation platforms today and some commercial providers of these platforms, just as examples. Some of these platforms I have worked with as part of the National Virtue Wheel project, but I don't have any commercial interest in these platforms. I'm just providing them as examples. For those who don't know, Simulation Canada, we are the national network of sim centers across the country. I estimate there's over 200 sim labs at colleges and universities and hospitals around Canada. 70 are official members with us, but we connect about 5,000 people in Canada and internationally. Shameless plug here for the Sim Expo, which is coming up in November and has a theme on AI and simulation. I know a few people in this call have already put in abstracts, so we're looking forward to seeing some of you. All right, virtual simulation. It's a vague term. It's used a lot to mean potentially different things. So I wanted to make sure to narrow down on a definition to start today. Virtual simulation can mean that the simulation, the simulator itself is virtual. And in turn, that could be referring to simulations played on a flat screen like a computer or a tablet or a phone. These have been called screen-based simulations or virtual gaming sims or virtual patients. In the literature, especially until recently, they tended to be called virtual patients in the medical education literature. They tend to be called virtual gaming simulations in the nursing literature. Virtual simulation, I've also heard people use the term to include extended reality modalities like VR and augmented reality. And then separate from that, I've heard the term virtual simulation being used to refer to physical simulations like mannequin-based or standardized patients, but delivered with participants over Zoom. So it's a physical simulation, but delivered virtually. So just for clarity today, we are talking about this here, the screen-based simulations, where the simulator itself is a computer program. Oh, that can go away now. How do I make that go away? Bye. Clear all drawings. Okay. Whoop. All right. So screen-based simulation, um, to define exactly what it is, it's a computer program or app. It simulates some aspect of a clinical encounter or process, much like any simulations we talk about, and users are actively engaged. They make decisions, and in most of them, those decisions have consequences. So the flow of the game changes depending on the decisions they make. I'm not going to dig into the evidence great, but I want deeply, but I wanted to start with just an acknowledgement that there are several systematic reviews encompassing, um, I would say dozens, probably not hundreds, but at least dozens of papers at this point about the uses of these technologies in healthcare education. The systematic reviews have confirmed that virtual patients can be used to expedite skill development better than traditional education methods. This can be in the cognitive domains, including clinical reasoning, especially around data gathering and diagnosis and management. Not so good for um, what seems to be more generic problem-solving abilities, and whether generic problem-solving abilities are even a thing, I know is a topic of debate in educational psychology, but certainly in domain-specific problem solving, such as diagnostic decision making and management, there's good evidence for it. It can also be used for non-technical skills such as communication and teamwork and socialization into professional roles, to the point that at the beginning of the pandemic, the Society for Simulation in Healthcare and INAXL released a joint statement on the value of virtual simulation. As far as where it fits into the buffet of modalities that we have available, um, mostly based on my own experience and the literature we do have, it seems to fit well when addressing critical thinking or judgment, decision-making type of competencies, or in the affective domain, interpersonal skills such as teamwork. Perhaps not quite as good fit, but I would argue this is changing very quickly with new technologies, is the procedural knowledge part of psychomotor skills. So learning indications, contraindications, equipment needed, steps of a task, errors that could be made in troubleshooting those errors, and communication skills, especially with AI-powered virtual simulations. I think there's a lot more potential emerging now. There's also the possibility of using virtual simulations for integration, putting it all together in context. So combining challenges of communication, diagnostic thinking and decision making, management decision making, interprofessional communication all together in one simulation. So let's talk about the way these virtual patients are constructed. And some of you may have seen these pictures before from other talks I've given, so I'll go through them fairly quickly. And the other thing I wanted to acknowledge is that the lines between these are very quickly becoming blurred. Again, with AI, like especially large language models now powering some of these simulations, um, we're seeing these features start to intertwine. So the distinctions between these different types are not as clear as they were even 6 months ago. Linear virtual simulations just take the learner along a path from beginning to end. There's no branching. At different points, they may have to gather more information, make some decisions, answer a question, get some feedback, but ultimately, the path doesn't really change. And there's certainly, these are kind of on the borderline of whether it's really a simulation or more just kind of a standard learning object. Branching simulations change their path depending on the responses or the choices that a learner makes. Um, so as they go along, they're presented with more information. They have to make decisions, and that changes the next node they see, the next information they get, and the trajectory of the case. Pseudo branching, from a player point of view, seems very similar, but from a programming point of view is a lot easier because instead of allowing branches and then more branches and then more branches, which grows exponentially in terms of having to program the case, you try to keep learners directed back towards one or two or three main paths. And there might be some other branches, but they come back in. Exploratory cases or virtual simulations are open-ended. These ones try to emulate a real clinical encounter with a patient where you don't have a finite list of options to choose from, where you have to decide what questions am I going to ask based on those answers, what follow-up questions am I going to ask, um, when do I feel like I've gathered all the information I need, what physical exam or other assessments am I going to do, what tests am I going to order. And once I have all that information, how do I compile it into a picture, a clinical picture for this patient, generate a differential diagnosis, and decide how to proceed from here. Um, until recently, again, these were very hard to program and design because you can imagine there's an almost infinite number of questions you could ask a patient or client in front of you. And to program all of those options and get the simulator to provide an appropriate response in all those cases was very difficult. But there were platforms that did it. Moving on to responsive. Responsive cases are ones that are meant to react to your decisions in real time. These are often used for critical care education. So if you give a bolus of fluids, if you give a vasopressor, if you change an oxygenation device, you're going to see a physiologic change in the patient in real time. Often these are driven by complicated physiologic algorithms behind the scenes. Some virtual simulations are really meant for communication and are meant to emulate either the technical and or the affective parts of communication, and that could be between a healthcare provider and a client, or it could be among healthcare providers in order to create a interprofessional simulation. Procedural virtual simulations focus more on a procedure. Again, we are not quite, but technology is barreling along. So we're not quite at the point where we can teach the psychomotor aspects of a procedural task. Although for anyone who was at SimExpo last year and tried out the Peregrine glove, which can be coupled with VR in order to give a tactile sense of what you're doing and manipulate objects with your hand, you know technology is moving quickly. But certainly for those cognitive aspects of procedures, these virtual simulations tend to focus on those applications. Collaborative virtual sims, while not really a different architecture than the other types, are meant to be played by multiple people and enable interprofessional learning. These cases are designed for either in real time for multiple students to come together and work through a case, or asynchronously. There are ways that these cases are engineered so that students can actually join at different points in time, but still have to contribute to interprofessional dialogue, which may happen during a synchronous session or make use of like a discussion forum in order to work together and solve a case. And there's interactive videos now too, both flat screen videos and 360-degree videos where there can be pauses and questions or decision points built into the video itself. And no talk in the world is complete without a mention of crossover with AI. These days, I've already mentioned a few, but to call attention to some of the things that I'm seeing as far as the intersection of AI and virtual simulation. One is scenario writing, where this is really no different than helping to create scenarios for standardized patient or mannequin-based simulations, whether talking about authoring a backstory for a patient or authoring a script. Um, some virtual simulations now build large language models into the software itself so that you can either text with the virtual patient, type in and they'll write back to you, or you can speak in real time to the virtual patient and they will use a whole series of different AI models from speech to text, and then large language models, and then um, text to speech models so that they'll respond to you in not quite, but close to real time. Uh, I see AI models being used to generate artwork and video. So we'll talk in a few minutes about the importance of building character narrative in virtual simulations. Um, and I've seen some incredible artwork used to AI generated artwork used to create images, paintings to go along with um, virtual simulations. Haven't seen a whole lot of video yet, and in my experiencing um, or experimenting, I've found that the video apps really do not do a great job of capturing any clinical information. They're great if you want a rabbit riding on the back of a turtle, but not so great if you want to show something specific medically. They're being used to power branching. So that branching scenario architecture I showed you earlier, until recently, the way you had to operationalize that was to provide a learner with a short list, 3, 4, 5 options to choose from, and they would have to choose. Now, large language models are being built into the simulation such that you can ask the learner an open-ended question. They have to respond, and the language model will map their response to the most likely trajectory out of the 3 or 4 or 5 behind the scenes, so that you don't have to queue the students, but you can still constrain the number of paths that the case can take. And finally, for assessment and feedback. So even in a virtual simulation, if there's a conversational aspect, whether that's done through text or through live audio or video, um, large language models can analyze those interactions and provide feedback. Um, they can monitor the clicking path that a learner takes through a virtual simulation and provide feedback on that. Or if you have your student at the end of the case, say, write a note summary or provide an SBAR, it can provide an analysis of that text compared to an expert written exemplar. So lots of ways I see it intersecting already. If you're curious about what platforms are out there, this started during the pandemic when virtual simulations became all the rage. We compiled a list of platforms that are available. We put the Canadian ones at the top of the list. There's several that are free and open source. There's some that are commercial but offer some free cases or free authoring with some limitations. Um, but if you're looking for options, you can find that on our website, and I'll give you some examples today too. One is called Open Labyrinth. This was actually created by a group out of University of Calgary. It's an international consortium now, completely academic, completely open source, now on their 4th version, um, and allows you to write mostly branching cases. You can enhance it with some videos, some texting with an educator who can secretly be playing the role of the patient. But as far as free and open source goes, it's pretty powerful what it can do. Another Canadian solution, this one commercial, but does offer a free tier, is called Affinity Learning. This is one we've used a lot in the Virtue Wheel project, which I'll talk about. Um, and it is evolving very quickly to introduce more AI-powered features, such as the AI deciding on the branching for you, um, or AI providing feedback. It does some really interesting things, and they've got a very strong um, um, interface for non-technical people to build their own simulations. They've done a nice job. CyberPatient is another Canadian solution. This one was more exploratory. So their goal was to provide that open-ended experience where you meet uh, a patient and have to decide what questions you're going to ask, what physical exams are you going to do, and then put that together into a diagnosis and treatment plan. They've got cases for medicine, cases for nursing, and this came out of University of British Columbia. This is a newer platform I just learned about recently. Don't have a ton of experience with myself, but it was actually developed by I believe a couple medical students in Alberta who were practicing for their OSCEs and wanted a platform to help them practice and prepare for OSCEs. Um, the interface at the moment is a little basic, but it's easy to use. There's a lot of cases in there that have been trained by faculty from across the country, and they are actively looking for national collaborators to help grow this or to apply for funding at the national level. So if uh, if that piques your interest, take a look, and there's a contact address there. A couple others I wanted to draw attention to that one of which I've worked with is PCS Spark here. This one is both exploratory in that it's open-ended and responsive in that there'll be physiological changes to your interventions. And I did a little video last night in which I was pretending to be a respiratory therapist, which I am not, so please don't judge me. But I wanted to give a little demo of how this works. A little quiet, but are you getting audio through? Petal, did you get any audio? No?
No, sometimes you have to go into your Zoom and say enhance audio for video so that we can all hear it. You might need to stop sharing to do that though.
Hmm. Let me just check audio settings quick. Microphone. Background noise removal. Hmm. Okay. No. All right. Never mind. I didn't rehearse for that. Um, so what you could see if we could run this video is just me asking open-ended questions, some more medical, some more affective about how he's feeling. This is a man who came into the hospital, needed a tracheostomy, and is now being taught how to clean it and care for it himself before being discharged home. So there's both the educational component to this simulation and a technical component in that you need to show him, teach him about the equipment and show him how to do the procedure. Um, SimConverse is another platform I learned about recently, this one out of Australia. Apparently, they built their own large language models trained from the ground up. So this is not a customization of ChatGPT. This is actually their own language models meant for creating text-based conversations with patients. And don't have a ton of experience with it personally, but it was one that um, I was impressed with at first pass and thought it'd be worth flagging. There are dozens of different platforms though, and if you visit that list on our website, you can find lots of other options. As far as finding virtual simulation cases, so like a lot of in the simulation world, it's incredible how much people are willing to share, and folks will spend a lot of time creating these virtual simulations and often be willing to share them. So there are places where you can find libraries with free virtual sims. I know Open Labyrinth has a lot. I know Affinity has what they call their community portal. Um, and the project that I've mentioned, VirtuWill, which stands for Virtual Work Integrated Learning, is a national project led by Colleges and Institutes Canada in partnership with Simulation Canada. We've worked with educators across the country to develop and release over 200 free virtual simulations that are all listed on our website. Admittedly, these were built for nursing, paramedicine, med lab science, respiratory therapy, and sonography. So none of them were um, planned for medicine to specifically, but it's incredible how many of them overlap and can be applicable to other professionals because of overlaps in scope of practice. And the intention with all of these too was for them to be open source. So if one of them, is close to but not quite matching your need, the source materials are available on request, and it could be edited and tweaked to suit different audiences of students. Right, some notes about designing and delivering virtual simulations, because this is an area, virtual simulations, at least virtual patients, have been around for over 20 years. Um, but it's been a very niche area, even within simulation, until recently. Um, but there has been growth in terms of the research base behind them, and we do have some guidance as far as good design principles and good um, practices for delivering virtual sims. The design guidance for them is no different than for any simulation. So I put up the standard of best practice here for simulation design, and you can follow the same method. It applies equally to virtual simulations as other modalities. Of course, you're starting with your needs assessment and defining your objectives. That determines what architecture is most relevant and will help you achieve those goals, which in turn guides your choice about which platform, taking into account feasibility considerations. From there, you write your scenario, develop your characters, fill in the details, produce your media, then put it all together into the virtual simulation. Wanted to emphasize the narrative here. What we've found in all the simulations we've built is the importance of building a story into the simulation, even ones that tend to be more technical or procedural, benefit from having that technical learning embedded within a real story about a real, um, or hypothetically real patient. And building out that story, both in terms of text and some of the media, gives a realism, um, an emotional poignancy to the simulations that makes them much more powerful and helps differentiate them from an interactive learning object, for example. The other thing we found hugely helpful in the authoring process um, is getting collaborators involved. As the virtual project has evolved, we've kind of refined our peer review process. Um, and this has been a formative peer review process, but it's incredible to see the additional quality added to the simulations when authors bring in other subject matter experts, especially if you're looking at a virtual simulation that you want to be applicable beyond your own walls. Incredibly helpful to bring in a subject matter expert or educator from another institution or another jurisdiction, because sometimes there are subtleties about a different piece of equipment that's used elsewhere, a different drug that tends to be preferred, something different about the clinical culture um, that others will pick up on that you can use to enhance your simulation. We also, in the development process, always had these simulations tested by students because as educators, we all make the mistake of not knowing or taking for granted what we know. And students having a student test it will help identify areas where things are confusing or not clear to them. So you can um, try to remove um, those obstacles to them being able to learn optimally in the simulation. We also had an EDI committee as part of this that developed some guidance around considerations, cultural safety considerations in virtual simulations. We had them review all of the simulations that we developed, and some of them really, did not need that review. We wanted to include it nonetheless, and other ones, especially ones where um, there were issues of interprofessional communication, there were issues of cultural safety, um, there were issues of language barriers. Um, the patients presented were newcomers to Canada or had Indigenous backgrounds, where having that perspective from an EDI committee that had really spent time thinking about cultural safety and some nuances of communication, um, and in many cases, even involving a person with lived experience, really made a difference in terms of um, the quality of the final product. And um, it wasn't uncommon for really open-minded um, authors with great intentions and very well-meaning, still including tropes or stereotypes or subtleties of language that when you're the person in position of privilege, you don't pick up on. So really incredible value in involving alternate perspectives there too. And then another big consideration I often talk with about folks is whether to include video because I see it still. There's this temptation to want to or to assume that video will enhance the simulation. So um, I dug into the literature a bit about this question. Um, there are some studies on text-based versus video-based virtual patients. One found that the video was better at short-term learning, but no different on retention. Another found no difference at short-term, but video was better on retention. A third one found no difference in either. And a fourth one found that students prefer text because if you've ever done online learning and had to sit through and not be able to accelerate a video, as you know, humans can read and process information much faster than we can speak. So watching a video when you can capture the information you need through text can actually be quite frustrating for learners. There's also a study looking at text versus video in PBL cases, so not quite virtual simulation, but at least in the medical education context. Um, and they found two opposite findings. One found that the deeper, more sophisticated thinking was more prevalent for text and the other for video. So no clear guidance there. There's the references for the previous one. So do you need video? My my guidance to folks is that if you need to show something that cannot be shown through text or video, like a certain behavior, certain context, something in the background, or demonstrating very precise technical skills, yes, makes sense. Use video. If it's a virtual simulation and say you're working with standardized patients and you want to capture some of the emotional poignancy of the simulation, yes, video can certainly make sense for that if you have a strong actor. If you have a poor actor, it's not going to help you. Um, but other than that, you don't need video um, in order to create engagement from students, and it may actually hinder engagement or lead to frustration if it's used in times when you can communicate that information without video. And of course, virtual simulations, like all simulations, don't exist in a vacuum. We don't just say, here's your simulation, bye. Um, we, we have to consider how we're going to enact this. So yes, there's a pre-briefing component to every virtual simulation. There is a debriefing component to every virtual simulation. That debriefing component could happen within the simulation itself, um, by either using programmed feedback or AI generated feedback within the simulation. Or increasingly, what we're seeing is that educators are planning synchronous debriefing sessions for after a student or group of students do a virtual simulation. So in the virtual project, what we're encouraging educators to do is have their students go through a set of 2, 3, or 4 virtual simulations and then have a group debrief afterwards. And research and evaluation we've been doing on that is leading us or showing us that there is incremental value to that facilitated live group debrief in addition to any programmed feedback within the case. And of course, you want these to exist in a sensible way within a broader curriculum plan. When you actually go to deliver these simulations, there's different ways you can do it. One is to have students do it independently. You provide them the link, they go off, do it on their own. And then afterwards may or may not have a debrief together. Another is to do it in person. So you get a group together in a classroom, project the virtual simulation up on the screen, and walk through it, talk through it together. And another is to do that same kind of process, but to do it virtually over Zoom. And all three of them have advantages, and all three of them have disadvantages. No good research yet, kind of guiding us as to which might lead to better learning outcomes. Um, um, but from a pedagogical theory point of view, there are certainly benefits to each approach. Some further guidance about enacting or delivering virtual simulations is available through this ebook, which was led by Marg Verkyle. And that's a free ebook available through eCampus Ontario. And as part of the Virtual project, we also have created a 2-part workshop on embedding virtual simulation. This is mostly online learning, but there's a couple synchronous sessions. Because it was subsidized through Virtual, the enrollment is free. So if you're interested in learning more about ways to use a virtual simulation, how to plan it, integrate it into your curriculum, we will soon be announcing some more offerings of that workshop, which is free for Canadian educators. And at that, we're at questions.
Perfect timing, Tim. Maybe we can stop sharing so that
Yeah, so it looks like a
chat, nice
group
chat
together.
session. Yeah. I remember when we built our virtual reality simulations for the suicide risk and the opioid overdose, we used Twine, an
Okay.
open free source tool to allow for the branching. So, and even then it was quite painful and complex, you know, when we had all the different possibilities for that conversation to unfold. And
Yeah.
so I love that slide where you talked about, you know, AI being able to speed that up and really step in there and make a difference. It's a game changer, really.
Oh,
Um,
it's incredible. Once you have a few decision points with a few decisions each, the number of branches grows so quickly. Um, and even though that could provide the most clinically realistic way for a case to play out, it does get hard to build.
yeah. And that interferes with the authenticity, right? Because you want people to practice as though it were a real conversation. So yeah.
Lisa,
Hi, Tim. Thank you so
is
much.
that right? And hi, Lisa. Hi,
Thank
Lisa.
you so much for a wonderful presentation. Really enjoyed it. In fact, I wrote all those platforms down that you mentioned regarding um, you could go to and create. Anyhow, my question is, do we have any idea how many people are actually using these tools that are available for creating the scenarios, as I feel like it might be a really nice opportunity just to send out a questionnaire for everyone to see who has used it and if they had any comments on it as well. I mean, it's great you've been there and you've been able to share with us all the information, but I just wondered how many people are using them.
It it depends on context. So um, I would say use in terms of delivering them has really taken off since the pandemic. Um, but as far as the number of people authoring them, I suspect it's still, relatively small. Um, Certainly what we've seen through Virtual and even outside of Virtual, just through other folks I've talked to, um, it still seems to take a champion, a couple people on faculty or on staff who are really keen on this modality, who familiarize themselves with a couple different platforms and how they work. The learning curve for some of these isn't too steep, but there's still a learning curve. Um, um, and what we've seen, which has been wonderful, is that some folks who participated in Virtual as an author and went through the coaching and faculty development as part of that have continued to build simulations outside, on their own for other purposes. Um, so I couldn't, unfortunately, quantify it for you. I could tell you that these cases have been played by students tens of thousands, if not hundreds of thousands of times now. Um, so there's definitely a need and a place for them, I think, in the simulation ecosystem.
Great, thank you.
No others have.
We have a quiet group here. We're all in awe of the work that you've done, Tim. I
Or
don't
eating
know,
lunch,
like, or eating lunch.
or eating lunch. Hi, Nazanin.
Hey, I'm just making a comment. It was a great talk. Thank you. There were a lot of great points. We're all kind of at that same exact place right now. Everybody's talking. We're all doing a little bit of everything you meant, not everything, but a lot of things that you mentioned, but also we're all thinking and planning for a lot of other things that you mentioned. So a lot of great insights. Thank you. Just a thank you comment.
Lisa, yeah, I'm happy to share the presentation, Petal. I don't know. I know you usually like post the video to your YouTube
Yes.
channel. I did send along a PDF of the PowerPoint itself. Feel free to share that if you
Yeah,
want as well.
yeah, because people won't have a copy of the slides. So if you want a copy of Tim's slides, just email me. I can forward it to you. But we will be posting this talk on our YouTube channel that you can share with your friends who are interested. Sarah's got her hand up, and then I was going to ask a question about the cyber patient that you mentioned.
Yeah. Mine's more of a comment and an idea of another platform we've been experimenting with. First off, I really enjoyed the dichotomy of how you went over virtual sims. I think the language was really clear that way, so I appreciate that.
Thanks.
One of the things that platforms we've been experimenting with, and we are using it more as a preparation sim, is around communication. So we've been using the paid version of ChatGPT to build basically SPs for an individual sim. And so then the nice thing and people with free accounts can use these GPTs we built, and the learners can have a conversation with an SP who is ChatGPT. And then they can share the transcript with us. The other thing that's been beneficial is in that programming, which is all done without programming language, is you can program at the end to provide a debrief prompt, whether it's a plus delta that the learner does, and then ChatGPT does some analysis as well. And so that's working nicely for more your communication sim. So we haven't yet built it into your full virtual sim where we use it as the sim, but we actually use it more as the preparation. And so we've got a few example use cases we've been playing with. So just another idea of
Yeah.
a very
Sarah,
simple, it's very simple once you figure out the prompting.
are
Just
are
another idea.
you like are you building ChatGPT assistants? Is that
Yeah, so you know those
you're
when
using?
you've got the paid version, you can
Yeah.
build your own GPT. I think they call it your own GPT. I have to look at the language, but you make your own GPT. I first started to experiment with making different cases all within the GPT. That doesn't work; it gets confused.
Mhm.
But you can essentially build one case, and you put in the background all the information you would normally give an SP and how they should communicate. And if this question is asked, reply this way. And so we've used it for handovers. We've used it for sort of death notifications with paramedic. And we've also, I'm starting to play around with new simulation facilitators, then practicing advocacy inquiry questions. So just some use cases, and it takes a little bit of playing, but just another idea for everybody out there.
Yeah. It's I'm guessing, Sarah, maybe this is the interface you use so this is
Yeah,
a
yeah,
GPT assistant. So you give it the system instructions, which the student can't see, but that tells it like who it is and how to
yeah,
respond, right? And
yeah,
then this gives you could a shareable URL so that students can chat with this assistant,
yeah.
play a certain role.
Just
Um,
another platform
yeah, that's a
to
good idea.
try. We're not far down the road on it, but it's proved useful, especially for sort of your new, like your undergraduate learners who need to practice certain communication skills.
So
Just
it's
a
like
comment. Thank
AI.
you for your presentation.
Sarah.
So it's those AI powered chatbots or
Mhm.
avatars. A lot of people are, taking off with those because yeah, the accessibility of the LLMs make it exciting to sort of experiment with. We're doing some work there too. What about the cyber patient that you mentioned, Tim? Like, how easy is that? Is that free for anyone to access?
I don't think it is. You'll have to forgive me. It's been over a year, I think, since I last connected with the cyber patient team. Um, to my knowledge, it's a commercial solution that's spun out of UBC. I don't think it's available free, although they may have some free cases.
Yeah,
Um,
good to know.
um, and I also don't know if they've upgraded their system now to make use of language models as well, rather than you may have noticed on that screenshot when they built the technology, their approach was to have a huge database of questions you could ask, and you had to kind of search for the question that you wanted to ask. And then I don't know how technologically behind the scenes they mapped all those questions to an appropriate response for every case. But they did. Um, and of, of course, now like a language model would do a much quicker job than that kind of database. Lisa's got a question there. Do you have any experience with a platform called HeyGen? No, I don't. What's this, Lisa?
I attended another sim session where a nurse educator was sharing her experience, and it is an AI platform where they have an avatar where you can select, what the person looks like, as well as, their tone of voice, those sort of things, if they have an accent. And in kind of the same sort of lens that Sarah was mentioning, you can build in the prompts of how you want them to respond. So she was sharing her experience in doing assessing their students like cultural competence is how she worded it, and had a rubric, and it seems like a really fantastic way that they did synchronously in Zoom. um, and I haven't yet tested it out, but I'm really interested to use that around communication type of virtual sim for IPE.
No, I haven't had experience. That sounds cool, but I haven't had experience with that either. I'm also curious too, that I find technologically the avatars are a little like behind the voice still. And I still personally get Uncanny Valley from the avatars, um, because they're not quite there yet. But um, again, technology is moving so quickly. I'd be curious to see that though.
I watch a lot of foreign films. You know, when they dub in the foreign films, it's got that lag, right? And it's a bit off-putting.
And one of the papers I looked at, like a very recent paper, I'm just going to share my screen again, um, referred to this robotic platform. So there's like motion to the robotic head and then a projected face on it that can change expressions, and then coupled that with a large language model so that you can have a dialogue with it and it can provide motion and expression in response to you. I have no experience with this personally, but folks out there are doing this kind of thing. So it's like, don't ask me what's going to be an option 6 months or 12 months from now. I just have no answer for you.
And that's a thing, right? Like the technology is moving in leaps and bounds, and that's why I'm gonna have to keep having these SimCity rounds every 6 months and bring in new people. But we're so grateful to you, Tim. Another one that we're using is Google Gemini to make AI avatars, but also requires a fee to purchase, and they charge according to number of words. They call them tokens.
Yeah. Yeah.
Yeah. So none of it is completely free at this point, unfortunately.
No, it's amazing how cheap some of the language models are. Even though you're paying per token, you can have a 30-minute dialogue and it costs you 30 cents. So it's
Yeah.
still pretty affordable. Anita.
Hey, thanks, Tim. I really loved your presentation. It was really interesting. Um, and I think you might have answered a little bit of my question towards the end of your presentation. Um, I want to learn more, but I feel very green. Back in the day, I did use Twine at one point, and it was a super steep learning curve. And I think that was before we were talking about AI as a tool, as a beneficial tool. It was something that we were actually discouraged from using at the time that I was working on this project. And it now seems like the landscape has changed like incredibly. So I guess, yeah, I know you mentioned workshop and a toolkit, but just for someone who is super green, but also super interested to learn more and
Yeah.
like kind of like what like yeah, acknowledging that it might be a bit of a steep learning curve for me. I'm curious what you
I
think.
I would say so. I put the link to Affinity Learning there. And again, Affinity is a commercial, it's Canadian, but it's a commercial solution. But I can just say I've been so impressed by their efforts to make a user-friendly interface. I think the best way to start, if you're curious, is create a free account there and play, like take an hour or two and just play around with what's possible. And they've got kind of like a visual designer for you to build the flow. And then each node you get to choose what type of interaction you want at that point, from something as simple as, an open-ended text question or a multiple choice question to AI powered things. And it's a fun tool. It's well done. Again, no commercial interest, just I've been impressed with it. Yes, Body Swaps is another one out there. I think they're out of the UK. I'm not as familiar with them. I know they were at SimExpo last year, though.
Mhm.
Like there's a ton of and I've heard of others using Twine. That's not the first time I've heard Twine come up. Um, there's one called H5P that's also available in open source. Some folks have used that. It's more for learning objects, but it's got the features to build a virtual simulation. But honestly, I think the most accessible way to get started is just to play with Affinity. That's where I'd start. And then if you're really into it and you want to know more about some design principles, there's the ebook, there's um, the online workshop I mentioned, but I would say start by playing.
Cool. Thank you. Thank you, everybody in the chat as well.
All right. So with 1 minute to go, I'm going to say a heartfelt thanks to you, Tim, for joining us from Ottawa. We're so grateful, as always, for your knowledge and expertise when it comes to the world of sim. And no doubt you'll be hearing from us again in the
My pleasure.
future. so you can keep us up to speed. And I thank all of you for taking your lunch hour to join us today and for the exciting discussion that we had. And please join us in June, where we will have Dr. Venkat Bhatt talking to us about some of his simulation work. Have a great rest of your day, everyone.
Thanks, Petal, for the invitation.
Always. Bye.
Bye, everyone.